Most seniors want to keep living independently in their own homes for as long as possible, and many of them rely on their children or spouse to help them. But when seniors can't live on their own anymore, they need access to a long-term care facility. In BC, there are several types of long-term care homes, ranging from assisted living where seniors get some help with meals and daily living, to residential care where 24-hour medical care is provided. I traveled to Vanderhoof in northern BC, where I met Frank and his daughter Trudy at an assisted living facility where Frank now lives.
It really has worked out well. You don't have to worry about him. There's lots of people around that we know. They take good care, and it really isn't like being in an institute. It is a home.
The whole people that run it and work in it are good people. They make you feel like they care, and they do. And that's important when you're getting on in years. I'd be pretty lonesome if I sat here and didn't talk to anybody and nobody cared. I mean, you know, and that the contact when they play games or play bingo or whatever's going on, it's all part of your life. And without it, it'd be just a lonesome place to sit and look at the wall, I guess.
When I think about Dad staying in the house by himself and what it would be like, stress-wise family, trying to make sure that someone's checking on him every day or trying to get him out, here he can make the choice, and the staff truly has made it like an extended family.
Well, I would say the effect of this community has a great deal to do with my health. If there wasn't a community that cared and that you cared about, I don't think I'd be here. As long as I have family that cares, I got friends that cared, I got friends and family that I can care about and maybe help along the road a little bit, I've got a reason to keep on living. If I haven't got any of that, I might as well die.
Not everyone has been as lucky as Frank. When I traveled back to Vancouver, I met Rebecca and Jessica, two sisters who struggled to get appropriate care for their mother.
A couple of years ago, our mom, who at the time was 60, started to have some unusual symptoms, including some memory loss and some problems with her speech. So this happened several times while she was in extended care, where she would say that she needed to use the washroom. We would press the buzzer, and it would sometimes take up to 30 minutes for someone to come and assist with the transfer. Because sometimes what would happen is after 30 minutes, one of the nurses would show up and she'd say, I can't put her on the commode because there's nobody else available to assist with the transfer. So one of us would do it. And then it would take 30, 45 minutes to get somebody back to put her back in bed after she'd used the bathroom. I would walk the floors looking for anyone, and sometimes I couldn't find a single staff member because the only one or two were tending to someone else. I don't know how on earth anyone gets their needs met in the healthcare system if you don't have family members to advocate for you. And so for seniors who have families who can and are willing to do it, things are okay. And even for families like us, it's tough. It is really tough.
We have as much support as I can imagine anyone would. We have unbelievable friends, unbelievable other family members that have stepped in.
Yeah, and it's still enormously difficult for us. And that's a really good point, is that we have a network of friends, family support, financial means that most people don't have. It's a horrible thing to do to seniors in their last years of life, and then at the time when they need the system the most, it's not there for them, and they do end up living their last years with not a lot of dignity.
There has been quite an increase in the number of families that are providing support and the amount of time they end up providing support for families in both residential care and assisted living. So, you think you're putting someone in long-term care and it's going to mean the burden is off the family, but actually people end up having to spend more time when they're in long-term care or assisted living.
Carolyn Unsworth has worked as a care aide for over 20 years and has struggled with lack of staffing and what that means for her ability to care for patients.
Some patients die scared, and all they want you to do is sit and hold their hand. And as their breathing becomes fast, their hand gets tighter and tighter on yours, and they're scared. And you sit there and you reassure them and you say, it's okay, you're okay, I'm here. And you can't do that when you have to look after 14 other patients. So I would be running in there and looking at these big eyes and saying, "You're okay, you're fine." And I'd be running out to see the other patients. And to walk into that room and discover during your shift that that patient has died and they died alone is one of the lowest points of my job, that I wasn't there for them. That privilege should have been ours. We should have been there at the end. And many times that was denied us and denied the patient. So I'm not proud of that. It's very simple. Look after the whole patient, not just the medical problem, and see that patient as a human being and see their family as people who are frustrated with a system that they doesn't see is looking after the person they love.
They've done some interesting interviews with residents of long-term care facilities and asked them, what is it that is most important to your quality of life? The single biggest thing in one of the surveys was that it's the relationships with the caregivers. And those relationships don't happen if caregivers are completely stressed and running around and having to juggle 15 residents in a shift. They happen when there's time for the caregivers to get to know the resident as an individual. They're not just someone on the assembly line that they have to get cleaned up, get fed, and put to bed.